Hey everyone, are you ready to nerd out on gut health? Well, then you've come to the right place. I'm excited today to share with you a number of recent studies that inform how you can resolve constipation, acid reflux, and food reactivity. And perhaps better yet still, do so with natural dietary lifestyle and supplemental interventions. And the other thing I just want to call your attention to before we jump in on the specifics is the fact that when you take steps to improve your gut health, to improve constipation, food reactivity, reflux, it's not unusual to see other symptoms improve. You may notice you sleep better, you have less joint pain, you have clearer skin, you have a clearer mind. And this is why I'm so excited about gut health in general, and why I've dedicated my life to this. It's also in part due to my personal experience, as you may know. So bear in mind that the effort you exert to improve constipation, reflux, reactivity to foods may yield multiple other benefits. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health. We break through the bias and the noise to bring you simple, trustworthy information that matters. So to start things off, let's discuss constipation. And I'm really happy to report that walking has been shown to clinically and meaningfully improve constipation. A 2019 meta-analysis summarizing 5 clinical trials compared either usual care, which may include laxatives, but not limited to, the sort of recommendations you would get from your gastroenterologist regarding constipation, which can be all fine and good, but in some cases are lackluster. So normal, usual care compared to walking for 20 to 30 minutes per day. And they found there was a significant improvement in constipation when people simply went for a 20 to 30 minute walk. And quoting the researchers here, more time spent on physical activity was associated with more rapid gut transit time. So remember that if you move, your food moves also. Okay, what if you're already walking for 20 to 30 minutes per day? Fair. A additional study in this instance, a 2023 meta-analysis, looked at abdominal massage, simply rubbing one's abdomen. And they found that abdominal massage was equal or better to usual care, which includes but is not limited to lifestyle recommendations and laxatives. The laxative piece is one that I wanted to expand upon briefly. I've heard 2 things from people when they come to work with us after they've seen perhaps their conventional gastroenterologist. One is, let's say something like Linzess, a pharmaceutical laxative. It can work, but there can be side effects. Those side effects may be abdominal discomfort, or you trade constipation for bowel urgency. And I have no, overt opposition to Linzess, but people complain about this as the one, and then on the other, people will remark, and I think very intuitively, very astutely, that I don't feel like the laxative medication is really solving the problem. I still don't feel fully well, which is why something like this study, which by the way was a meta-analysis summarizing 13 clinical trials, finding a large impact, a large effect size, as it's known, on constipation is quite remarkable. Why it is that abdominal massage may be helpful? Perhaps 2-fold reasons, not an exhaustive list, but there are differences anatomically in the shape of the hose that is one's intestinal tract. And in some cases, the pipework, if you will, can be what's sometimes known as tortuous. The intestines have these sharp turns, tortuous sort of anatomy to them. You can have inflection points where stool or food gets backed up and slows down. It's almost like a traffic jam on a highway, or if there was a windy road, people slow down going around the turn. And simply having some motion can help massage stool through that impasse, so to speak. 2, the other one is if you've had either abdominal physical trauma or inflammation, you can form scar tissue that can press on the tubing and lead to that same sort of inflection point or slowdown point for which the massage can help to sort of unstick or unstuck the food as it's moving through the intestinal lumen. It's a really simple way and effective way to improve regularity. And to quote these researchers, abdominal massage therapy shows definitive therapeutic efficacy for functional constipation. So this was a great study giving us another simple, safe, natural technique to improve regularity. And I'll also link to a video that we recommend in our consulting practice. It's not the Bible, so it's just one video to give you a sense of the technique, but in my estimation, we have checked this. There doesn't seem to be one superior technique per se. So this is a good example of where we don't want to let striving for the perfect be the enemy of the good. So a simple protocol of rubbing your belly 10 minutes or maybe even less most days of the week may be sufficient. And when this works, by the way, you're going to see results within a couple of days to a week. So if you're going to try it, just realize you're not waiting for 4 weeks, 8 weeks, or 12 weeks to assess if this is helpful. You'll usually know fairly early on. By the way, if you're enjoying this video, please comment and subscribe. Okay, and in my view, no discussion on regularity would be complete without looking at probiotics. So this enters a 2023 meta-analysis of 13 different randomized control trials. They looked at prokinetic medications versus prokinetic medications combined with probiotics. Now, prokinetic medications are similar to laxatives, but a little bit different in the sense that they directly stimulate motility. And Ruscio or prucalopride would be one example of a few that have been documented to be effective for constipation, these medications. They do have side effects, so they're not without any risk. And so this would be something to discuss with your gastroenterologist, of course. But here's what was interesting about this study. When they combined prokinetics with probiotics, there was a 4-fold greater improvement in constipation and in regularity. The probiotic formula was different because remember, there's 13 different studies, different trials here. The general summary of the probiotics used was a blend of lactobacillus species plus bifidobacterium species plus soil-based species at a dose of 1 billion per day. So nothing novel or different in terms of, was this a special, unique probiotic, the only formula that would work for constipation? No. Different formulas all showing benefit. And here's why I think we're seeing the benefit even across different formulas. One of the things that we know probiotics will do is improve the balance of the microbiota, the world of bacteria in your gut. Now, whether we're looking at an imbalance in the microbiota, dysbiosis, or an overgrowth, small intestinal bacterial overgrowth, SIBO, probiotics have been documented to help with either of these conditions. Here's how this connects to constipation. In this diagram, what you're seeing is a microbiota, and what it's sort of intonating or intended to express is that a healthy microbiota will lead to healthier levels of 5-HT, which is 5-hydroxytryptamine, which is serotonin. And serotonin regulates, in part, as you see here, propulsive motility, or the ability to move food through your intestinal tract and therefore have regular bowels. As a side note, serotonin also modulates what's known as nociception or pain signaling. So there's, like many times in natural medicine, we use a probiotic, let's say, to treat constipation, and the person has improved regularity, but at the same time, they also have improvements in abdominal pain and discomfort. So I wanted to share this schematic and a credit to Nature Reviews Gastroenterology and Hepatology for this really nice diagram that helps us to see that we improve what regulates the motility with a healthy gut microbiota, which is serotonin levels in the gut. The next study I felt of merit was looking at ginger. This was a clinical trial in roughly 50 patients who had gastrointestinal symptoms and also had multiple sclerosis. So we have to be a little bit careful because this is a specific population. But nevertheless, let's look at what they found. Comparing placebo to a 500 milligram ginger capsule that was taken 3 times per day, they found that ginger improved constipation and bloating. The researchers commented as follows, quote, "Ginger supplementation for 12 weeks significantly reduced the frequency and severity of constipation as well as the severity of bloating." So like I was saying a moment ago, the nice thing about these natural agents is they have multifold actions. In this case, ginger improves constipation and improves bloating, and the probiotics improve regularity or motility and may also improve things like pain and discomfort. Regarding ginger, it's anti-inflammatory, but it also contains these compounds known as gingerols, not ginger ale, but gingerols. And these gingerols have been documented to increase serotonin in the gut. And this is one of the mechanisms through which ginger will improve motility. Ginger is also used in pregnant women for nausea. So a lot of benefits associated with ginger. And you can take ginger as a tea, or there are 2 products that I'll share here wherein usually you'll need 1 or 2 capsules of ginger to hit that 500 milligram, and you can take 1 to 3 times per day. Remember, these studies used 500 milligrams 3 times per day. I wouldn't get overly into, or this one study, because it was a 1 randomized control trial, I wouldn't get overly into the weeds in terms of do you have to be uber specific in your dose. If you can take the 500 milligrams 3 times per day, great. If you can have a cup of ginger tea 1, 2, or 3 times per day, great. And this will move you in the direction of healing your gut, reducing symptoms, and improving regularity. And the final point here I wanted to make was regarding pelvic floor therapy for otherwise non-responsive constipation. So think about your care plan following the flow of the studies that we've outlined. Lifestyle and supplemental interventions first. And then this would be if you've done all of those other things and you're still not seeing the regularity that you'd like to have. So in this clinical trial, 40 patients with constipation and who had pelvic floor dysfunction and were also unresponsive to laxatives and lifestyle modifications underwent pelvic floor biofeedback, and they experienced a 50% reduction in the severity of their constipation. What is pelvic floor biofeedback? I always reference Satish Rao, who is a gastroenterologist at U Augusta, who was on the podcast a number of years ago. His analogy was a tube of toothpaste. We want to take the cap off and squeeze the contents, therefore expelling the toothpaste. And in pelvic floor maltiming, if you will, or malcoordination of the muscular contractions, what can end up happening is your anal sphincter stays closed, the cap stays on, and you don't contract to expel the stool. And what the biofeedback therapy does is help people re-engage or correctly engage the musculature, where you contract the abdomen, to create pressure to expel the toothpaste or the stool, and you relax the anal sphincter to allow stool out. Populations that may be at highest risk for pelvic floor dysfunction would be postpartum women and people who have had surgical trauma, like hysterectomies, as one example, but not an exhaustive list. And also people who are training really hard and they're doing a lot of bearing down. All of these things, and also, those who are aging as a natural byproduct of aging, sort of weakness in the pelvic floor musculature. And the pelvic floor is essentially between either the penis, vagina, and the anus, right? It's that literally the floor of your body. And we've had some nice conversations with Jandra Mueller, who is a pelvic floor therapist. I'll put some resources for her and her clinic here, and also another directory if you wanted to look into that. So when we summarize everything that we've discussed, we have some great options for improving regularity. Walking, remember, if you move, your stool moves. Abdominal massage, probiotics, ginger, and pelvic floor PT. So a lot of tools that you can use to improve your bowels. Now, moving on to acid reflux. There was a study looking at gluten-free dieting and its ability to improve reflux. In this study, 80 patients who had silent reflux. So this is where you have a cough, asthma, hoarseness, a metallic taste in your mouth, perhaps postnasal drip. They were given a gluten-free diet. They found that reflux improved in 77% of individuals. So pretty remarkable finding. And the researchers commented, positive gluten antibodies did not predict who would experience improvements in symptoms on a gluten-free diet. Now, what does this tell us? Why do I share this quote? Firstly, over-testing is a serious problem in the realm of gut health. And this is a perfect example of where the lab marker would have led these people astray because the gluten antibodies did not predict who would improve. Secondly, that there can be other reasons for which gluten is a problem beyond the antibodies. And this is nicely exemplified by the next study I wanted to share with you. It was a clinical trial, albeit small, 8 patients who had GERD, gastroesophageal reflux disease, and IBS. But here's what's interesting. They were given either a high FODMAP or a low FODMAP diet. They found that the high FODMAP diet led to worse reflux. Foods that are high in FODMAPs are certain fruits and vegetables that are rich in prebiotics that feed bacteria. Probiotics are the bacteria, prebiotics feed the bacteria. And so the low FODMAP diet that restricted prebiotics and therefore didn't feed bacteria had improvements in reflux. So what does this tell us? Well, firstly, that a diet that is mindful of if someone has bacterial overgrowth is important to keep in mind when people have things like reflux. But it also ties to gluten. How? Because gluten is high in FODMAPs. And I've had a growing suspicion that when people experience benefits from going gluten-free, it may be because they're reducing FODMAPs in their diet, and it's not necessarily that they have an allergy to gluten. In fact, I want to thank Dr. Michael Camilleri, who is a gastroenterologist and researcher at Mayo Clinic, for recommending a hopefully future podcast guest who is one of the preeminent researchers in non-celiac gluten sensitivity. So keep an eye out for this interview. But Michael's comment to me was that this researcher suspects that there's a fair subset of people who have gluten reactivity wherein it's the FODMAPs and not actually the antigenicity or the inflammatory reaction to the gluten. Why does this matter? Because FODMAP reactivity tends to be temporary, meaning if you improve your gut health by going on a low FODMAP diet, as just one example, things balance. We know that a low FODMAP diet starves overgrowths and has been shown to reduce SIBO gas levels, so small intestinal bacterial overgrowth gas levels reduce. And then people can very successfully reintroduce these foods at a later date and have good tolerance. So why this whole thing matters is if you're in the paradigm of, if I remove gluten and I feel better, that means permanent gluten reactivity. That is usually, in my opinion, and the data here are still being mapped out, but that is usually incorrect because there appears to be much more prevalence of FODMAP intolerance than there is gluten intolerance. Now, to clarify my position here, I'm not saying that if you've gone off gluten and you feel better, that that's invalid. But what I'm trying to help you to see, or potentially see, is that that may have been due to a FODMAP restriction, which can correct imbalances in the microbiota and then allow you to enjoy gluten at a later date. And the overarching reason why I share this is a growing concern I have that people are becoming afraid of food. If you don't like grains, if you feel that grains are bad and no one should eat them, that's your prerogative, that's fine. I don't think that's what the data generally support. But what I'd like at very minimum for you to have is the freedom when you're at a restaurant or a dinner party or a wedding or what have you, to be able to have some pasta, a slice of pizza, some bread, some crackers, whatever it is, at very least to equip you with really the data they can help you to see that the reactivity might be FODMAPs and not permanent. And again, at bare minimum, you have the food freedom and not food fear. So anyway, moving on to another intervention that can be helpful for reflux. Fasting, 2023 clinical trial, again, kind of small, 25 participants. They consolidated their eating to an 8-hour window. And what they found was that after 2 days of intermittent fasting, they had improved reflux and improved heartburn. And to quote the researchers, our data shows that short intermittent fasting improves symptoms of both regurgitation and heartburn. A simple tool you can use, an 8-hour feeding window is not super hard. It's not a multiple day fast. So it's something for a couple days, in this case 2 days, could be helpful in reducing inflammation and improving your reflux. And then the final study here as it pertains to reflux I wanted to share involves something we've discussed on the podcast before, curcumin, this anti-inflammatory spice. And in this trial, 15 patients with dyspepsia, so indigestion. This was 151 patients, so it's an even better sample size. They compared omeprazole, aka Prilosec, against curcumin, and they found equivalency in the outcomes, which in my mind is absolutely amazing. So instead of using omeprazole and suppressing acid, which can have some deleterious benefits, I do think acid suppression in the short term is justifiable. Is it ideal? No. Is it justifiable? Yes. You have a different option of curcumin at a dose of 1 gram per day. And that has been shown, again, from this trial to be equivalent. This led the researchers to comment as follows, quote, curcumin and omeprazole had comparable efficacy for improving dyspepsia. So fantastic news, growing evidence for natural medicines, in this case, curcumin and its efficacy for reflux. Part of what's happening underneath the hood with curcumin, as I mentioned a moment ago, is its anti-inflammatory action. Now, specifically, if we want to get a little bit down into the weeds, curcumin, amongst other mechanisms, suppresses a pathway known as NF-kappa B. This is an inflammatory pathway, and the expression of NF-kappa B can lead to inflammation, and the suppression of NF-kappa B, which curcumin does, can reduce inflammation and therefore improve reflux. So regarding reflux, some great options for you: gluten-free, low FODMAP, fasting, and curcumin. Again, simple things that you have ready access to that may improve your reflux and also improve other symptoms at the same time. And then finally, let's talk about food reactivity. One study that I found fairly noteworthy documented that stress increased food reactivity. Now, if you're stressed, hang on, I'll give you a solution in a moment. Well, let's just first identify the connection. They looked at just under 800 patients with IBS who had psychological distress, and they noted that that stress correlated, again, with increased food reactivity. Quoting, we found that a higher score of psychological stress was associated with greater food reactivity. And part of what's going on here, and this is from Barrett and colleagues, and I loved this study. What they examined in this study was the blood of people who are high stress or low stress. How they assessed their blood was injection of LPS, lipopolysaccharide. This is one of the things that leaks through a leaky gut. And they found across the board that those who were more stressed had a higher inflammatory response to that LPS. And the people who had less stress had less of a response. So we know that stress can alter your immune system and make you more pro-inflammatory. But here is the good news. Interventions that reduce stress have been shown to reduce at least the symptoms of IBS. So this enters a 2023 randomized control trial. People received either general IBS advice, again, what you might get from your GP or your gastroenterologist, or they did yoga and meditation for 1 hour per day. And they found that the yoga and meditation led to reduced stress and reduced IBS symptoms, kicker here, without any changes to their diet. So if you're not doing something, it could be as simple as walking in nature. It could be yoga and meditation. Remember how powerful these are in improving your gut health. And one of the main reasons why I want to sort of underscore this is so that you don't jump too quickly to testing and to supplement, and you start with lifestyle and food first. There's more good news here. A different study looked at a CBT app, a cognitive behavioral therapy app. And they found that compared to the control group that received what's known as a waitlist control, the app known as Zemedy led to improvements in fear of food, into catastrophizing one symptom, so thinking about their symptoms, being worried about their symptoms, and improvements in IBS symptoms. Quoting, Zemedy is a promising and effective way to help those suffering from IBS. And this is something that we've started integrating into some of our clinical recommendations in our practice, because some people need some help sort of unwinding an unhealthy association that they have with food. So wonderful options, whether it be yoga and meditation, a cognitive behavioral therapy app, which is really convenient. There are options here to reduce stress and to reduce food reactivity and the symptoms of IBS. We've also done a video on food intolerances, so if you wanted to take a deeper dive specifically on food intolerances, that resource is available for you. Remember that natural options are plentiful, whether they be dietary, exercise, yoga, meditation, walking in nature, or just walking in general, and various supplements, ginger, curcumin, probiotics, can all help you improve your health. And this would not be just consolidated to your gut health, but would permeate beyond that, because remember, in some of these studies, there were other improvements beyond just gut health. And it's routine to see people who have, let's say, better regularity, have better body odor and skin, or who have less abdominal pain, sleep better, and therefore may have better mood and mental clarity. One note I wanted to leave you with. I'm reading a book right now called Pillars of the Earth by Ken Follett. It's a fiction book. I haven't read a fiction book, and I can't remember how long, but I was looking for something that got me out of sort of health and medicine, and this has been a nice sort of reprieve from always having to think. And it's a very well-written, easy to kind of get lost in narrative that Follett has written in this book. But he tells the story of Job. It's a biblical story, but I think it has a secular lesson we can take away from it. And Job had everything going for him: a healthy family, wealth, and personal health. And all of these things were taken away from Job as sort of this contest, if you will, between good and evil, or God and the devil, to test his resiliency or his faith. And the parallel I would draw for you is, if you're not feeling well, don't forget to maintain and hold on to your belief that you can heal and that you can improve. Because as someone who's been through the hellscape, similar to Job, who lost his family, who lost his wealth, and then lost his health, but maintained the belief that he would get well, he eventually did. So don't forget the importance of maintaining the mindset of, however unpleasant your current situation is, you can improve. And I can say, as someone, again, who's been there, I know how trying it is, but don't lose sight of the fact that you can improve your health. And when you do, all of the suffering will hopefully be worth it. And out the other side, you've now emerged with some wisdom, some perspective, some empathy. Okay, well, hopefully this has been as interesting for you as it is for me, and also, most importantly, helps you improve your health. All right, guys, this is Dr. Ruscio. I'll talk to you next time.